Hello, everyone, and welcome. Today, I want to talk about something incredibly important, something that touches the lives of so many men and their families, yet often remains unspoken. We're going to discuss prostate cancer, specifically the silent signs that every man should be aware of. This isn't about fear, it's about empowerment, about giving you the knowledge to take control of your health. Because when it comes to something as serious as cancer, early detection isn't just a phrase, it's a lifeline. Have you ever felt a subtle change in your body, something you dismissed as just a part of getting older, or perhaps something you were too busy to pay attention to? Sit down calmly. You need this solution, don't you? Then don't skip. Watch the full video carefully. Like, comment, and share it on your social media.
Now, let's dive into the heart of the matter. Prostate cancer, in its earliest stages, often presents no obvious symptoms. That's why it's so crucial to understand what we call the silent signs. These aren't always dramatic or painful. They can be subtle, easily overlooked, or attributed to other, less serious conditions. But recognizing them, even the slightest hint, can make all the difference.
One of the most common areas where these silent signs might manifest is in urinary habits. You might notice a change in how often you need to urinate, especially at night. Perhaps you're finding yourself getting up multiple times, disrupting your sleep. Or maybe you're experiencing a weak or interrupted flow of urine or difficulty starting urination, even when you feel the urge. It could also be a feeling that your bladder isn't completely empty after you've finished. These changes, while potentially indicative of other benign prostate conditions like BPH, benign prostatic hyperplasia, should never be ignored. They warrant a conversation with your doctor, a simple checkup that could provide immense peace of mind or, if necessary, lead to early intervention. Beyond urinary changes, another silent sign can involve your sexual health. You might experience difficulty achieving or maintaining an erection, or perhaps painful ejaculation. Some men might even notice a decreased volume of ejaculation. While these issues can be influenced by many factors, including stress, diet, and other health conditions, their sudden onset or persistence, especially when combined with other subtle changes, should prompt a medical evaluation. It's about understanding your body's baseline and recognizing when something deviates from that norm. Then there's the less common but equally important sign of blood in your urine or semen. This is a symptom that, while often associated with more advanced stages of prostate cancer, can sometimes appear earlier. It's a clear signal that something is amiss and requires immediate medical attention. Even if it's just a fleeting observation, don't dismiss it. Your health is too important to take chances. It's also vital to consider unexplained pain or discomfort. While prostate cancer typically doesn't cause pain in its early stages, if it begins to spread, it can manifest as persistent pain in the lower back, hips, or thighs. This isn't just a muscle ache from a long day, it's a deep, nagging pain that doesn't go away. If you're experiencing this kind of discomfort without a clear explanation, especially if it's worsening over time, it's a sign that needs to be investigated. Now, I know what some of you might be thinking. This sounds scary. And yes, the word cancer can be frightening. But my intention here isn't to instill fear. It's to empower you with knowledge. The vast majority of prostate cancers are slow growing, and when detected early, the prognosis is often excellent. That's why understanding these silent signs, and more importantly, acting on them, is so incredibly powerful. Let's talk about risk factors, because understanding them can help you be even more proactive. Age is a significant factor. The older you get, the higher your risk. Family history also plays a crucial role. If your father or brother had prostate cancer, especially at a younger age, your risk increases. Ethnicity is another consideration, with African American men having a higher risk and often developing the disease at an earlier age. While you can't change these factors, being aware of them means you can be more vigilant about screening and discussions with your doctor. And speaking of screening, this is where the conversation truly shifts from passive awareness to active prevention. The PSA, prostate-specific antigen blood test, and a digital rectal exam, DRE, are the primary screening tools. There's been a lot of discussion around PSA testing, and it's true that it's not perfect. It can sometimes lead to false positives or detect slow-growing cancers that might never cause harm. However, when used judiciously and in conjunction with other factors, it remains a valuable tool for early detection. The decision to screen is a personal one, and it should always be made in consultation with your doctor, considering your individual risk factors and preferences. I encourage you to have an open and honest conversation with your healthcare provider about prostate cancer screening. Discuss your family history, your concerns, and your lifestyle. Together, you can determine the most appropriate screening schedule for you. Remember, regular checkups are not just about treating illness, they're about maintaining wellness and catching potential issues before they become serious problems. Beyond screening, there are lifestyle choices that can contribute to overall prostate health and potentially reduce your risk. A diet rich in fruits, vegetables, and whole grains, and low in red and processed meats is beneficial for your entire body, including your prostate. Regular physical activity, maintaining a healthy weight, and limiting alcohol consumption are all positive steps you can take. These aren't guarantees against cancer, but they certainly stack the odds in your favor, promoting a healthier you in every aspect. I want to emphasize that you are not alone in this journey. Prostate cancer is a common diagnosis, and there are countless resources available for support, information, and treatment. Organizations dedicated to prostate cancer research and advocacy offer a wealth of knowledge and a community of individuals who understand what you're going through. Don't hesitate to reach out and connect with these resources if you or a loved one are facing this challenge. My hope is that this video serves as a wake-up call, a gentle nudge to prioritize your health. Don't wait for obvious symptoms to appear. Be proactive, listen to your body, even the whispers. Those silent signs, those subtle changes, are your body's way of communicating with you, and by paying attention, by seeking medical advice when something feels off, you are taking a powerful step towards a healthier, longer life. Remember, knowledge is power, and early detection saves lives. Take care of yourselves, and I'll see you in the next video. Stay healthy, stay informed, and always advocate for your well-being. Let's delve deeper into these urinary changes, as they are often the first, albeit subtle, indicators. When I talk about frequent urination, especially at night, I'm referring to nocturia. It's not just about getting older and having a weaker bladder. If you're consistently waking up 2, 3, or even more times a night to urinate, and this is a new or worsening pattern for you, it's a symptom that demands attention. Think about how this impacts your sleep quality, your energy levels during the day, and your overall well-being. It's more than just an inconvenience. It could be a signal from your body. The weak or interrupted urine flow can also be quite telling. Imagine trying to empty a garden hose that's kinked. The flow is hesitant, not strong and steady. Or perhaps you start urinating and then it stops midstream, only to resume a moment later. This start and stop pattern, or a noticeably weaker stream than you're used to, is a common complaint. And that feeling of incomplete bladder emptying? It's a sensation that can lead to constant trips to the bathroom, even if only a small amount of urine is passed. This can be particularly frustrating and disruptive to daily life. While these symptoms can indeed be caused by benign prostatic hyperplasia, or BPH, which is a non-cancerous enlargement of the prostate that's very common as men age, it's impossible to differentiate between BPH and early prostate cancer based on symptoms alone. That's why medical evaluation is paramount. Your doctor can perform tests to determine the cause of these symptoms and guide you towards the appropriate course of action, whether it's managing BPH or investigating further for prostate cancer. Ignoring these signs is like ignoring a check engine light in your car. It might be something minor, but it could also be a warning of a much larger problem down the road. Your body is giving you clues. It's up to you to pay attention and seek professional guidance. Moving on to the sexual health aspects, it's important to approach this topic with sensitivity and understanding. Erectile dysfunction, or difficulty achieving or maintaining an erection firm enough for sexual intercourse, is a common concern for many men as they age. However, when it occurs suddenly or is accompanied by other symptoms, it warrants investigation. It's not just about the physical act, it's about your quality of life, your relationships, and your self-esteem. Painful ejaculation, while less common, is another symptom that should never be dismissed. It's a clear deviation from normal bodily function and could indicate an underlying issue with the prostate or surrounding structures. Similarly, a noticeable decrease in the volume of ejaculate can be a subtle but significant change. These symptoms, especially when they appear together or in conjunction with urinary changes, paint a more complete picture that your doctor needs to see. I understand that discussing sexual health can be uncomfortable or embarrassing for some men, but I urge you to overcome that hesitation. Your doctor is there to help you, not to judge. Open communication is key to accurate diagnosis and effective treatment. Remember, these are not just isolated incidents. They are potential pieces of a puzzle that your body is trying to solve, and you are an active participant in that solution. Now let's address the more alarming, yet sometimes silent, presence of blood. The appearance of blood in your urine, known as hematuria, or in your semen, known as hematospermia, is a red flag that should never be ignored. Even if it's just a faint pink tinge or a single instance, it requires immediate medical attention. While there can be other causes for blood in urine or semen, such as infections or other benign conditions, it can also be a sign of prostate cancer, especially in more advanced stages. The key here is silent because sometimes these occurrences are so subtle that they might go unnoticed unless you are actively looking for them. For instance, hematuria might only be visible under a microscope during a routine urine test, or hematospermia might be a fleeting observation. This is why being attuned to your body and reporting any unusual changes, no matter how minor they seem, is so important. Don't rationalize it away or assume it will disappear. A prompt medical evaluation can help determine the cause and ensure that if it is something serious, it is addressed without delay. Your proactive approach in reporting such symptoms can be life-saving. Regarding unexplained pain, this is a symptom that often indicates more advanced disease, but it's crucial to understand its characteristics. When prostate cancer spreads beyond the prostate gland, it often metastasizes to the bones, particularly in the lower back, hips, and thighs. This bone pain is typically persistent, deep, and aching, and it doesn't improve with rest or over-the-counter pain relievers. It's different from the occasional muscle soreness or joint pain that many people experience as they age. If you're experiencing new, persistent bone pain without a clear injury or explanation, and especially if it's worsening, it's a symptom that needs urgent medical attention. This type of pain can also be accompanied by other systemic symptoms like unexplained weight loss or fatigue. While these are not specific to prostate cancer, their presence alongside persistent bone pain should raise a significant concern. Again, the emphasis is on unexplained. If you can't attribute the pain to a specific event or activity, it's a signal that your body is sending you, and it's one you should never ignore. Early recognition of these signs, even if they indicate more advanced disease, can still lead to effective treatment options and improve quality of life. It's about listening to your body's distress signals and responding with timely medical intervention. Now, let's shift our focus to the broader picture of risk factors and how they interact with these silent signs. While age, family history, and ethnicity are non-modifiable risk factors, understanding them empowers you to be more vigilant. For instance, if you have a close relative, a father or brother, who was diagnosed with prostate cancer before the age of 65, your risk is significantly higher. This genetic predisposition means you should start discussing screening with your doctor at an earlier age than the general population. Similarly, if you are of African American descent, the statistics show a higher incidence and mortality rate from prostate cancer, often at a younger age. This knowledge should prompt a more proactive approach to screening and regular health discussions. It's not about being alarmist, but about being informed and taking preventative measures tailored to your individual risk profile. While you can't change your genes or your heritage, you can change your approach to health management. This means being more diligent about regular checkups, understanding the nuances of screening, and being more aware of any subtle changes in your body. It's about taking ownership of your health journey and working collaboratively with your healthcare team to mitigate risks and ensure early detection. Let's talk more about screening, because this is where the rubber meets the road in terms of early detection. The PSA test, as I mentioned, measures the level of prostate-specific antigen in your blood. PSA is a protein produced by both normal and cancerous prostate cells. Elevated PSA levels can indicate prostate cancer, but they can also be elevated due to other conditions like BPH or prostatitis, inflammation of the prostate. This is why the PSA test is not a definitive diagnostic tool on its own. It's a screening tool that helps identify men who might need further investigation. The digital rectal exam, or DRE, is another important screening tool where your doctor manually checks your prostate for any abnormalities in size, shape, or texture. While it might be uncomfortable, it's a quick and valuable part of the screening process. The decision to undergo PSA testing and DRE is a nuanced one, and it's not a one-size-fits-all approach. Guidelines from various medical organizations differ slightly, but generally, discussions about screening begin around age 50 for men at average risk, earlier for those with higher risk factors. It's crucial to have an informed discussion with your doctor about the potential benefits and risks of screening, considering your personal health history, family history, and preferences. The goal is to make an individualized decision that aligns with your values and health goals. Remember, screening is not about getting a diagnosis. It's about getting information that allows you to make informed decisions about your health. It's about being proactive rather than reactive. Beyond the medical aspects, let's consider the profound impact of lifestyle choices on prostate health. While there's no guaranteed way to prevent prostate cancer, adopting a healthy lifestyle can certainly reduce your risk and promote overall well-being. When I talk about a diet rich in fruits, vegetables, and whole grains, I'm referring to a pattern of eating that emphasizes plant-based foods, which are packed with antioxidants, vitamins, and fiber. These nutrients can help reduce inflammation and protect cells from damage. Limiting red and processed meats, which have been linked to an increased risk of certain cancers, is another important dietary consideration. Think about incorporating more fish, poultry, and plant-based protein sources into your diet. Regular physical activity is also incredibly beneficial. It helps maintain a healthy weight, reduces inflammation, and improves overall immune function. Aim for at least 30 minutes of moderate intensity exercise most days of the week. This could be brisk walking, jogging, swimming, or cycling. Maintaining a healthy weight is crucial, as obesity has been identified as a risk factor for more aggressive forms of prostate cancer. And finally, limiting alcohol consumption. While moderate alcohol intake may have some benefits for cardiovascular health, excessive alcohol consumption can negatively impact overall health and may increase cancer risk. These lifestyle modifications are not just about prostate health. They are about fostering a holistic approach to your well-being. They are actionable steps you can take every day to invest in your long-term health, empowering you to be an active participant in your own care. Finally, I want to touch upon the emotional and psychological aspects of dealing with prostate cancer, whether it's a diagnosis, the fear of one, or supporting a loved one through it. It's natural to feel a range of emotions: fear, anxiety, anger, sadness. These feelings are valid, and it's important to acknowledge them. Don't bottle them up. Seek support from your loved ones, friends, or a mental health professional. Support groups, both online and in person, can also provide a safe space to share your experiences and connect with others who understand what you're going through. Remember, you don't have to face this alone. There are resources and communities dedicated to helping men and their families navigate the challenges of prostate cancer. Organizations like the Prostate Cancer Foundation, Zero, the End of Prostate Cancer, and Us Too International offer invaluable information, support services, and advocacy. Reaching out is a sign of strength, not weakness. It's about building a robust support system that can help you cope with the emotional toll and make informed decisions about your treatment and care. Your mental and emotional well-being are just as important as your physical health, and nurturing them is an integral part of your overall health journey. This journey is about resilience, hope, and the power of community. Embrace the support available to you, and remember that every step you take towards understanding and addressing your health concerns is a step towards a brighter, healthier future. Your life, your health, your future, they are all worth fighting for. And by being informed, proactive, and connected, you are doing just that. Thank you for watching, and please take care of yourselves and each other. In closing, I want to reiterate that while the topic of prostate cancer can be daunting, it is also a story of hope and resilience. Medical science is constantly advancing, and with early detection and appropriate treatment, many men go on to live full, healthy lives after a prostate cancer diagnosis. Your role in this is paramount. Be informed, be vigilant, and be proactive. Don't let fear or discomfort prevent you from seeking the care you deserve. Your health is your most valuable asset, and investing in it through regular checkups, open communication with your doctor, and a healthy lifestyle is the best decision you can make. Let this video be a catalyst for change, a reminder that you have the power to influence your health trajectory. Embrace this power and live your life to the fullest, with peace of mind and vitality.